first of all, welcome. Thank you for coming. I'm sure we're going to have a great day today. Why don't we listen to each other, and this is meant to be very interactive today, listen to each other, because then we can try and make changes happen.
You have to embrace the grey. We are so used to living our lives in black and white, being in control. We have a problem, we find the solution, we fix it, we move on, we leave it behind. Being diagnosed with a serious illness means that isn't always possible, and that's very hard, not only physically but psychologically.
There's evidence that shows that already that 2 weeks of prehabilitation can actually significantly improve outcomes. That's talking to someone about diet, lifestyle, activity.
So increasingly patients are partners in their healthcare. It's about GPs and patients being a team.
I think one of the challenges in the questions we should ask ourselves today is whether we are the informed patient, the passive patient, the involved patient, or whether we shift from all of those three places depending on how we feel about ourselves at any given time.
It's no good saying a third of the population is going to live till 100. I want to know how much of that population is going to live well.
So it should hopefully prevent most of us being in famine and starvation and malnourished, hopefully. But is there any consideration about the overnourished?
Then we have impotence that affects about 30% of 40-year-olds and 40% of 50-year-olds. So it's very prevalent, and it's an early sign of cardiovascular disease.
It is hard to research into rare cancer because there just aren't that many patients, and you need lots of patients to make something statistically significant, and you need a lot of patients to actually do the trial.
Engagement and involvement, as well as citizen or public engagement involvement in research and in innovation.
So, Use My Data very simply is a movement of patients, carers, relatives, people who want to be involved in having a much stronger voice about how data gets used.
But open access quite simply means the ability to find a manuscript online and access it in full, normally from the journal's website.
Now, I'm here giving you a sex presentation, a sex talk on this. I have yet to discuss this with my medical professionals. Now, this is the point. If I struggle to do it, how many other people are struggling? I just want healthcare professionals to ask me.
So what we wanted to do in this brief talk is to tell you about a program that we've been developing about getting patients involved in the education of medical students, the future doctors.
We want the young students in the first and second years to see patients as people first.
And I don't think we're anywhere near making good use of all the channels of communication that are available to us today.
22nd of December 2004, my fourth child was born, Daisy, very, very prematurely and clearly very sick. And I had to negotiate this whole new world of caring for a child who we then found out had a very rare genetic disease.
In terms of my main work that I've done, I produced a graphic novel about diabetes because, you know, when you're diagnosed with something, what do you want to do? You want to go away and write a graphic novel about it, right? And actually, I really did want to do that because I didn't know what the hell was going on.
An engaged patient often has better outcomes, and this is really important when the healthcare environment is becoming increasingly value-based.
I think it was excellent. The main take-home for me is around real inclusivity of people, patients, carers, clinicians, professionals, all in the same place. And I do think that sort of combination works best to look at what works well, what doesn't work well, where improvements can be made. So I think it's been a really interesting, useful day.
I think it's been great. I really admire the organisation for doing this kind of pro bono work and being able to together. The main take home for me is underlying desire for patients to be involved in co-development, to really have input, right?